Never open your mouth unless you are sitting on a dental chair. Well, I am sitting on my dental chair and I'm going to open my mouth. Share my feedback, my first-hand experience, and show all the unique features of Dentium Bright Alone dental chair. This is Dr. Harshal Shah, practicing in Borivali, Mumbai, India, and I like too casual to show the unique features of a dental chair. Well, let me do something about it. Much better. So let's start with the doctor's table. The doctor's table has a platform of around 12 inches by 16 inches, which I believe is good enough to keep your surgical instruments, your endodontic instruments, your restorative instruments. They have a silicone pad which is autoclavable, so you can autoclave and reuse it. One more thing they have is an attached mouse pad and a cup holder. It's an optional, you can remove it if you want to, if you think it's an obstacle and you don't have enough space in your clinic. One more feature they have is they have an attachment for the tablet. You can mount a tablet or a screen over here. I have not opted for it because I have a separate screen, but yes, you can have a tablet or screen over here. So let's start with the control panel. The control panel starts with an LCD display, a knob to adjust your RPM, options given to move the chair up, down, back and front. There are 4 memory programs, which 1, 2 and 3 you can set the chair position, and the 4th being for the 0 position. Now if you can see, there are options to switch on and switch off the water supply, your light and your dental operative light. So if you can see, there are 2 tubings for your high-speed aerator or high-speed handpieces. Both of them are fiber optic, but you have an option to convert your fiber optic to a 2-hole by attachment of an original NSK connector. So if you can see over here, it's for fiber optic. Here I have attached an original NSK connector and converting my fiber optic into a normal 2-hole handpiece. So let's go with the 4th and the 5th option. The 4th is for your low speed handpiece and the 5th is for your scaler. If you want to use this attachment, you need to have an inbuilt original NSK micromotor and original NSK scaler, or you can have your external scaler and external micromotor. Let's imagine we have an original NSK scaler over here. So as soon as you lift it, the display screen will show general, perio and endo mode, and you can select whatever you want to. You can select whatever speed you want to. This is a great feature. You can also adjust the speed of water of your 3-way syringe, your spittoon and patient's plastic cup. So now let's come to my assistant's favorite section, of course the auxiliary table or the assistant's table. So there are 2 scopes of manipulation over here. There are 2 adjustments which can be made. One is from here, which is around 60 to 90 degrees, and other is from here. So as per the procedures, your dental assistant can manipulate the auxiliary table as per her comfort. Even your auxiliary table has a control panel which has option to manipulate the chair up, down, left and right. It has your memory program 1 and 0 position, and also an option to switch on and off your dental operative light. One of the key features of this chair is you can also perform certain procedures like scaling and small procedures even without your dental assistant. They have something called as an auxiliary arm and an auxiliary light. So what you need to do is, there are some magnetic components on the suction tube. Just attach that components, approximate, attached, and you're done. You can work without your dental assistant. Now let's come to the dental light. So the name of this dental light is C500. The maximum brightness which this light can give is around 50,000 lux. I think it's good enough to perform any dental procedure. You can manipulate this light from top to bottom at around 130 degrees and from left to right to around 90 degrees. As you can see, the chair light handle is detachable with magnetic attachments and it is autoclavable. One will have the luxury to work with 3 different intensities. You can work at 40,000 lux, 45,000 lux or 50,000 lux. You can also adjust the brightness. By clockwise, you can increase the brightness, and by counterclockwise, you can decrease the brightness. As you can see, when the paper cup is placed on the cup stand, the sensor will recognize the cup and supply a certain amount of water to the paper cup. Now you can see the spittoon is adjustable, which is great for elderly patients. A good dentist never get on your nerves, and a good dental chair should not get on a dentist's nerves. Most of the dentists understand the need of a high-end dental chair in their practice, but very few of them step up to it. I really hope with this video I've encouraged you all to step up and get one for yourself.